Welcome everyone to a brand new video. My name is Dr. Raghav Sharma. I'm currently in the last year of my physical medicine rehabilitation residency, and in previous videos I've talked a little bit about my upcoming fellowship, but I've never really talked about what exactly it is, and in this video I'm going to do exactly that. And a lot of you might be thinking, is it sports medicine? Is it pain medicine? No, it's not either of those, and it's a very unique fellowship that I think a lot of you, whether you are physical medicine rehabilitation residents, applying to medical school, or potentially as patients in the future, could be interested in. So make sure you stay tuned for the rest of this video because I think it's a good one. But before we do that, let's talk a little bit about what a fellowship is and why do a fellowship. So for most who are not kind of aware of the medical education system, there's kind of a lot of training that goes along the route before you become a full-fledged physician or an attending physician. So residency is the last stage before most physicians start looking for jobs as an attending physician. Some want to further specialize in either a singular body part or a procedural skill, and that is where the fellowship comes in. Anyone who graduates residency is competent and capable of becoming an attending physician in whatever field this is, but fellowship is for those who want a little bit more expertise in one specific niche category. This fellowship typically also gives much more exposure to those rare cases and zebras of whatever field it is, so that you get much more exposure with it and truly become a quote-unquote specialist. So for example, if you want to really become an expert of the heart, this is a cardiology fellowship for internal medicine residents or someone who's graduating a residency in internal medicine. For those zebras out there, someone who chooses to do a rheumatology fellowship after internal medicine will have much more exposure to those rare cases out there for things like granulomatosis with polyangiitis, those rare lupus cases, and the whole host of rare diseases. So you'll just have much more exposure and really be a specialist. Now, when it comes to the job market out there, some jobs, some positions out there, whether academic or private, strongly suggest or even require fellowships so that they're hiring the most qualified physician for that specific position and to take care of the patient population that they need and whatever that gap is. So, for example, a practice who's going to be taking care of a lot of patients with lung-based pathology will more than likely want someone to have a pulmonary fellowship because they want those fellows or they want those trained who have done a lot more bronchoscopies, a lot more experience in general with lung-based diseases than someone who's an internal medicine resident graduating who may have had a couple of months of exposure but not really dove into exactly just the lungs and really become a specialist. Fellowships for physical medicine rehabilitation are largely the same and based either on further interests and really become an expert in whatever that one interest is, or a desire for procedural skills, or a combination of both. So let's kind of talk a little bit about the fellowships in PM&R, but this is going to be very brief because there is another video right here where I talk about what is physical medicine rehabilitation, where we dive a little bit into the fellowship. So check that video out, but the next part's going to be brief. All right, so without going too far into it, because like I said, there's a whole video on specifically the what is physical medicine rehab and the fellowships out of it. Once again, that'll be linked here. I'm just going to briefly list a lot of the very common fellowships that there are from PM&R, and that starts with things like brain injury medicine, spinal cord injury medicine, sports medicine, pain medicine, cancer rehabilitation, neuromuscular medicine, spasticity, and I believe that is just about it as far as the very common ones. However, I'm not choosing to do any of those fellowships, and before I dive a little bit more into what that is and why that is, I'm going to talk a little bit about ACGME versus non-ACGME fellowships. Now, ACGME stands for the American College of Graduate Medical Education, and essentially they are a large, big governing body that accredits medical education after medical school. So anything after medical school is technically under the guidance of the ACGME. Every single residency in the country is ACGME accredited, which essentially provides some sort of standard, some sort of essentially governing body for this is what a residency is, to make sure that all of us within our specialties are trained to whatever specific competency it is that we are trained to do. Now, when it comes to fellowships beyond, there are also ACGME versus non-ACGME fellowships, and it's not necessarily a bad thing that a fellowship is non-ACGME, because if you think about it, fellowships are really to chase a niche and really to chase in specific interests within the field of medicine. If this was, as we say, standardized or made into some big kind of bureaucratic like conglomerate, then that would be kind of difficult to do because there are a lot of niches out there that aren't necessarily going to be well represented or don't have even that many people out there that are practicing it for it to become standardized. So In every field, there are a variety of fellowships that are both ACGME and non-ACGME accredited. And I'll talk about why that's important in just a second. And pretty much that is that my fellowship is non-ACGME accredited. And I chose to do something a little bit off the beaten path just because I think that it fits my specific interests much better. And I think it'll equip me with the best training to be able to take care of the future patients that I want to in the way that I want to take care of them. Before we get into what exactly my fellowship is, let's talk about the journey that I took to kind of find it and really hone down what I wanted to do. And this starts with musculoskeletal medicine. And coming into residency, I thought I wanted to be an expert of the musculoskeletal system, and I still do. And when it comes to physical medicine rehabilitation, the most common route for that is sports medicine. And I was no different. I was gung-ho on going into sports medicine. This is because sports medicine is an incredibly common fellowship. And a lot of people go into it from not just physical medicine rehab, but different fields as well, including family medicine, emergency medicine, and the like. So this is where I was, but being myself, I wanted to really confirm that this is what I wanted to do, and wanted to set myself up for success in the future. So I started reaching out to physicians that have been practicing, just like asking questions to a variety of people that have gone through fellowship recently, that are applying for fellowship, and also reading what's out there kind of on the internet through a variety of forums. And I realized that this might not be exactly what I was looking for. And this is for a couple of reasons. The biggest one was, number one, sports coverage. Now, as a PGY2 or a first-year resident in PM&R, I was doing a lot of sports coverage because this is something I was interested in, and it's something that builds up your CV for applying into a sports medicine fellowship. Now, what I realized was that when you become an attending, it doesn't really change, and the grind continues, and you'll be giving up a lot of Friday nights, a lot of Saturday mornings, and just a lot of extra time taking care of various sports medicine-related things with athletes. And this is oftentimes uncompensated time, and it's just kind of built into your contract, something you're expected to do. And unlike what we might think, that it's very glamorous, you're working for a professional sports team, it's not. Most of the time you're working for like your local high school or your local D3, D2 college, community college, whatever it may be that has a need for sports medicine coverage. And that's not something that I necessarily wanted to do because I wanted to spend time doing the things that I enjoy, hanging out with my family, going and traveling. As you might know, I'm interested in that. So just not something necessarily that I wanted to give up my time for in the future. And then secondly was the procedural skills available. And for me, I wanted to be able to offer the gamut of procedures to my patients if indicated. Whatever they walk in the door with, I wanted to be able to have some sort of tool that I can help them with outside of surgery. So anything surgery, no, but anything better than, or anything that's conservative, essentially not surgery, I wanted to be able to do. And I realized that sports medicine isn't necessarily going to prepare me to be able to do that because it really does not do much for the cervical spine, thoracic spine, and while it does do some lumbar spine, it really does not do a lot and doesn't train you in a lot of the more intensive procedures, and it'll do pretty much the basics for spinal intervention. You would get a lot of training in ultrasound, but this isn't necessarily something you could get outside of a sports medicine fellowship. There's a whole host of other reasons, and if you're interested, I can talk to you about it, DM me, but these were the two biggest reasons that I decided maybe not right for me. Then I looked into very briefly pain medicine because I was like, if I can't get the training and procedural skills that I want in sports medicine, then pain medicine is definitely the most advanced and most interventional and most invasive. But then I realized that quickly the mindset isn't necessarily for me because as a physiatrist, we really want to focus on quality of life and shared goal setting with the patient. And you find that in sports medicine, but that isn't necessarily the case in pain medicine. A lot of times the answer is just fix pain, and that's pretty much it. And this carries through because pain medicine isn't necessarily just a PM&R specialty. It's shared by anesthesiology. And in fact, historically, most of the people who practice pain medicine were anesthesiologists. So very different mindset when it comes to it, and not necessarily something that I jive with. So this was quickly out the window. So now the question was, if it's not sports medicine, it's not pain medicine, what do I do? Is a fellowship even right for me? Can I get these skills outside of the fellowship setting? Should I just do some sort of extra training in other places? So at this point, there was a lot of doubt and a lot of questions in my mind, but luckily I wasn't done there, and I continued digging and continued finding what would be right for me. All right, so In my research, I found that one of the big things to focus on here was to really maximize my ability to really get training in the hardest part of what I thought complete musculoskeletal care would be, and that is in axial procedures, because this is something that is much higher risk than any other procedure that we would perform within physical medicine rehab as a specialist. It's something that you would really want to get training in as far as getting the reps in under the guidance of someone else to make sure you are confident and competent in performing whatever injection that you need to perform within the axial spine. So it wasn't going to be pain. So then I was looking at what else can I do, and I came upon two organizations, with the first one being the International Pain and Spine Intervention Society, who happened to have a conference in Chicago, which is very close to where I'm at in Milwaukee. So I went down and attended the conference, and immediately I was like, wow, I like you people. Turns out most of them were physiatrists, and all of them were very concerned with the safety of procedures, with making sure that this was exactly what the patient needed and making sure to have an accurate diagnosis, really looking at how their procedures were performing, the benefits, the outcomes, all those different kinds of things. And I really found a like-minded group of people that I was like, I want to be kind of like you guys, and you guys could be good role models for myself. And then I realized a lot of them there were program directors for North American Spine Society, or NASS, fellowships. So the next conference was NASS, and turns out it was in Los Angeles, which my wife is from there, so it was an easy kind of way to get over there and an easy excuse to go visit family. So I attended this conference as well, and I found out a ton about interventional spine, about the different organizations within this kind of area, and the fellowships that NASS had. And specifically, this was a NASS Interventional Spine and Musculoskeletal Medicine Fellowship. So NASS ISMM was the fellowship, and I was like, wow, this is exactly kind of what I want, because you do interventional spine and musculoskeletal medicine. And these fellowships really combine three things. And number one, it's interventional spine procedures, and it covers the entire axial spine from kind of all the way up to the base of the head, all the way down to the sacrum. And some of these can get pretty interventional. However, they try to stay away from, quote unquote, a lot of things that pain providers might do as far as semi-surgical procedures, although there are programs that even offer that if you're interested. And they also do musculoskeletal medicine as far as ultrasound guided procedures. They're not going to get too intense on those and do some of like the cutting edge stuff, but they will do a lot of it, so you will get very good at the bread and butter ultrasound. And then also they combine electrodiagnostics or neuromuscular medicine with EMG and nerve conduction studies. And essentially this is really the kind of the best thing that we have as far as physiatrists when it comes to diagnosis of things relating to muscles and nerves, and it really helps you hone in on where the issue is. And I found this to be amazing. I personally love electrodiagnostics, and I think it is the perfect skill to accompany interventional spine procedures and peripheral procedures to really make sure that you have a patient, you know what's going on, and you're performing the correct procedure. So I was sold. I continued to talk to a lot of different people, but there was one big thing that I had as a question in my mind that luckily was alleviated, and that was, can I get a job? When it comes to employability, there are a variety of things to look into on the CV, and the ultimate one is obviously, are you competent or are you able to perform what we need you to do safely for these patients? Now, when it comes to fellowships, a lot of that turns to ACGME versus non-ACGME, because if you have a large accrediting body, you know that this person has finished this comprehensive curriculum that we know is vetted by some organization out there. And there are a number of takes on this, because some people say that people are more employable if they do an ACGME fellowship versus not, because it's kind of a known quantity of skills. And then when you talk to different institutions, some places will hire ACGME accredited fellows and completely say no to non-ACGME fellows, and some places don't care. And mostly in the private practice world, I've learned that people don't care. Now, this is a big question to me, because I wanted to make sure that I had all options available to me. So I started reaching out to people who had completed these NASS ISMM fellowships, and I quickly learned that people out there really do not seem to mind that it's a non-ACGME fellowship. And in fact, these people are getting jobs at top high institutions, top high academic institutions that you would think would want someone to be ACGME qualified. However, this just goes to show that the North American Spine Society fellowships were highly regarded, and that they know that North American Spine Society is a very large organization that has this fellowship, and it's kind of vetted through that instead of the ACGME. So quickly I was like, well, there's no issues as far as employability. This is exactly exactly the skill set I want to gain, and the majority of the people in this field are people that I think could be role models or are people that I want to practice like. So I was sold. Essentially, I applied, interviewed, and I joined and I will be joining a fellowship this coming summer. So that's kind of my journey. And now let's talk a little about what I intend to do with my future practice. In my practice, I want to be able to help people get back to their quality of life and help them move, because I think movement is kind of the basis of quality of life, whether it's playing with your grandkids, whether it's hiking Mount Kilimanjaro, running an ultramarathon, whatever it may be, playing in Sunday League. I want to help people move, and I think that's the way to really help someone enjoy their life. So I want to be able to provide comprehensive musculoskeletal care with a thing, as in any patient walking into my clinic with any sort of musculoskeletal issue, I want to be able to, number one, treat them with kindness and understand what they really want to be able to do and what their goals are. Number two, provide an accurate diagnosis, because an accurate diagnosis is kind of the baseline for a good treatment. So whether that is a great history and physical examination, performing nerve conduction studies, electrodiagnostics, ultrasound guided kind of diagnostics, whatever it may be to require a good diagnosis, I want to be able to do that. And number three, to be able to provide whatever appropriate and necessary intervention it is for that pathology. So whether that's an ultrasound guided procedure or whether it's a fluoroscopic guided procedure into the axial spine, I want to be able to perform that and make sure that I can help everything be in kind of alignment with what I want to do and the way that I want to treat my patients. And I don't want to have to like send patients out because, oh, I can't do this, oh, I can't do that. I want to be able to do whatever it is, and at the long term also be able to follow up my patients over the long term and promote their kind of longitudinal health through a variety of preventive medicine measures, the majority of this being kind of exercise, and those 5 pillars of health, which I can talk about in another video, probably in the next coming weeks. But incorporating some sort of strength training, some sort of resistance training within that. Maybe it's a gym in my practice. Maybe it's having personal trainers and the like around. Whatever that form ends up taking up, I want to be able to provide that comprehensive musculoskeletal care to really take care of my patients and help them get back to whatever it is that they enjoy. If you have stayed to the end of this video, then thank you very much for watching. I hope this video was helpful, and I hope it provided some sort of value, whether you are currently somewhere in medical training, already a PM&R resident, or just a patient who is looking to kind of understand more about the healthcare landscape and the different options of physicians available. Hopefully this provided some information on exactly what I'm going to be doing in the future, what my fellowship is. And if you have any questions, feel free to drop a comment down below or find me on social media platforms. I'm more than happy to help. Once again, subscribe to continue following my content and my journey as I kind of go through the medical landscape, I guess, and become an attending physician. So I'll see you in the next one.